Good morning. Welcome and thank you for attending today's session, which is sponsored by AIDS Healthcare Foundation. I am Adele Schwartz-Benzaken, Senior Medical Doctor for AHF Global Program. And we are here in this section. The title of the session is Resilient Amid War, AHF Ukraine's Continuity and Expansion of Medical Service. We will introduce you to real-life stories from professionals on the front lines of HIV/AIDS care in Ukraine. The continuity of HIV care in the country has proven to be remarkable resilience during the ongoing war. Despite an unprecedented refugee crisis, damaged healthcare infrastructure, and social and economic upheaval, AHF Ukraine and its partners managed to sustain and even grow its service. This panel will explore how this remarkable achievement was made possible thanks to the courage, dedication, and adaptability of the healthcare providers, volunteers, and administration on the mission to deliver uninterrupted care to the Ukrainians in the country and also beyond its border. So it's my pleasure to introduce our first speaker, that is Dr. Yaroslava Lopatina, AHF Country Program Director of Ukraine, and she has been AHF Ukraine Country Program Director since 2012 and throughout the war. She was one of the first doctors to establish HIV service in Ukraine. So her presentation, you can already see it, is responding to challenges and expanding HIV prevention and treatment service in condition of war. Please, Yaroslava, you can come.
Good morning, everybody. Before we start into presentations and discussions, I would like to take a moment to express my gratitude to the incredible AHF team behind this work. According to WHO UNAIDS, Ukraine continues to remain a region with a high level of HIV prevalence among the countries of Central Europe and East Asia. As of April 1, 2024, more than 157,000 people living with HIV were under medical supervision in healthcare facilities. According to official registration data, the highest HIV prevalence was recorded in Odessa, Dnipro, Mykolaiv regions, and in the city of Kyiv, consistent with the previous period. The highest number of new HIV infection cases was registered in 1999 in amount more than 33,000 persons. After that, the number of HIV cases has been falling and reached the level of 9,769 new cases in 2023. Latest data reveals that only 72% of people living with HIV are aware of their HIV status, and more than half of HIV diagnoses in Ukraine are made too late. I showed you this epidemiological data to demonstrate why AHF is in Ukraine. The full-scale war has been going on for more than 2.5 years. So the issue of studying the impact of military operations on the spread of HIV and STIs is particularly relevant today. AHF and Poltava Medical University conducted a study to identify factors during the war that can negatively affect the spread of HIV and STIs. This systematic review presents data on the impact of hostilities on the spread of HIV and STIs and outlines the main factors that contribute to the dissemination of pathogens far beyond the territory of the epicenter of the war. As a result of the evaluation of the selected articles for the systematic review, were identified migration, a decrease in access to healthcare, difficult access to contraception, drug use, and sexual violence as the most frequent factors directly affecting the spread of HIV and STIs during the war. More than 2 years of war in Ukraine have resulted in significant humanitarian consequences. The war has severely disrupted healthcare services, including those for HIV. Over 30 medical institutions providing HIV services have ceased operations due to destruction or occupation, and logistical chains have been significantly affected. AHF has been operating in Ukraine since 2009, and at the time of the outbreak of war in February 2022, AHF was working in 38 healthcare facilities in 17 regions of Ukraine. Before war, AHF provided 120,000 rapid HIV tests per year, distributed 400,000 condoms per year, and provide care and support to more than 50,000 people living with HIV. In general, poverty and the stress from changing place of residence significantly reduce the adherence of HIV-positive people to treatment or even contribute to its temporary discontinuation. First, it leads to an increase in viral load and higher infectiousness of people. The war exacerbates mental health problems as people experience stress, anxiety, and trauma due to war, the loss of loved ones and property, and threats to their lives. As people moved from east to west, the AHF responded by opening its program in the western part of Ukraine and developing other activities. It means we followed our clients. An additional challenge is providing medical care in areas with many internally displaced people where the healthcare system is under serious strain due to increase of patients and inadequate infrastructure. To overcome these challenges, a comprehensive strategy was needed, which included not only medical but also psychological and social support. AHF actively cooperates with 47 healthcare facilities throughout the controlled territory of Ukraine to ensure access to necessary medical services and treatment. AHF promptly responds to health challenges and continuously expands the range of services. We work to maintain and improve the health and quality of life of people living with HIV and do everything possible to meet their needs during this difficult time. I would like to emphasize that an improvement I would like to emphasize the important point was ensuring safeguarding HIV preventions and care services amidst military conflict. This includes preparing personnel for war, like trainings for personnel, ensuring personnel of food, of fuel, recommendation to keep cash, and these simple things that provided AHF for staff ensured people to be more confident during the period when war started. And all our experience important was published in BMG journal in this article. In 2023, AHF Ukraine launched an ambitious project to introduce testing for infections simultaneously: HIV, hepatitis B and C, and syphilis. Over the past year, using combined tests, we conducted testing for infections for 1,018,000 people aged 14-85 years. Integrated rapid testing for blood-borne viruses and syphilis can be an effective strategy because it allows for cost savings, optimization of diagnosis and treatment of patients, reduces stigma associated with HIV and syphilis testing, increases demand for testing, and enhances its accessibility. The number of cases of co-infection is relatively high in people with co-infection and are at higher risk of severe outcomes. To maximize the benefits of individual treatment for all 4 infections, it is critical to test and diagnose people as soon as possible, a challenge given that these infections can typically be asymptomatic for years. Early diagnosis of HIV, HBV, HCV, or syphilis is vital as it allows people to access treatment which significantly reduces associated long-term morbidity and mortality. In many cases, those most at risk of one of these infections are also more vulnerable to infection with other infections with similar transmissions, making an argument for integrated testing even stronger. Based on our results, different approaches for HIV and STI testing and medical supervision should target among MSM in Ukraine who are at high risk getting HIV and syphilis, and people who inject drugs with small prevalence of HIV and HCV among them. The integration of single-stage screening for HIV, viral hepatitis B, C, and syphilis can increase in the effectiveness of their screening, early diagnostic in healthcare facilities, and reach the groups most at risk at the community level. The cost effectiveness of using 4-component test requires further study. That's all from my side. Thank you for your attention.
Thank you, Yaroslava, and for showing us how to adapt not only infrastructure, how to move health providers from one point to another in the country, but also how to use new tools to improve service. So now we're going to have a video from Dr. Yaroslav Basarad. He has been AHF medical director in Ukraine since 2019, and he leads and coordinates all medical and prevention-related efforts within AHF program framework. And he's going to talk about resilience and expanding AHF clinical program for people living with HIV.
Dear colleagues, I am pleased to welcome you to the International AIDS Conference 2024, our satellite session. Unfortunately, due to circumstances which are beyond my control, I am not able to join our session personally. I have no conflict of interest. Nevertheless, I am honored to speak today about clinical programs of HEF Ukraine, being strongly committed to HEF mission, cutting-edge medicine and advocacy, regardless of the ability to pay. We reinforced our programs to meet the new needs of patients and to follow their roles during wartime. You know that war and its consequences, such as ruination and damage of medical facilities, disrupted logistics, lack of electricity and heating, lack of medical staff, and continuous migration of patients are our biggest challenges for now. Together with our partners, we do our best to serve our mission and to ensure access to qualitative medical care, retention, early prevention, diagnosis, and treatment of HIV and opportunistic infection. Unfortunately, we still face a lot of late diagnosis of HIV in Ukraine, which is a negative factor for achieving success in the treatment of HIV infection. More than 50% of patients are detected at late stage of HIV infection. Our clinical services are available in 47 partners' healthcare facilities in 23 regions of Ukraine. From the first day of the war, we were able to keep in touch with our patients. The hotline services was active all the time and worked in close connection with counseling and assistance on navigation. Patients received reliable and verified information throughout all the road in line with instruction on how to receive ARV therapy or prolonged opportunistic infection prophylaxis in the areas to which they moved. Expansion cooperation with the region where our patients were relocated give us the opportunity to stay with the patient and provide further clinical support and respond quickly. In the first months of war, the regions which were safer in terms of their military states accepted waves of relocated people and were not ready for such load and timely provision of opportunistic infection drugs. Despite all difficult with logistics, it was a priority for us to deliver opportunistic drugs to the region where they were needed or where sufficient stock was reported. HEF was one of the first in Ukraine to organize a Chapter 4 room for partner healthcare facilities. We keep control over the work of our clinical site, appointment schedule, availability of laboratory services, availability of drugs, and other medical services. This approach allowed us to respond quickly to the needs of our patients and to support them. HEF Ukraine focused on the needs of its clients and develops its clinical program correspondingly. HEF's own test and treat clinic in Odessa was opened more than 6 years ago. Our clinic is a charitable entity and it provides a full range of services to support HIV prevention, diagnosis, and treatment. Integrated care for our clients is provided by family doctor, mental health specialists, and infectious disease specialists. Multidisciplinary approach to support our clients is implemented by high qualified doctors, social workers, and peer counselors. We arrange social support for the clients of our clinic who are in difficult financial situation through Food for Health initiative and distributed food package. Support of peer counselor engagement of our clients to start club contributed a lot to commitment and retention of our clients in treatment. Test and Treat Clinic has many additional services that enhance high quality of care. Each patient has the opportunity to set up preliminary appointment with a doctor in our digital system with an option to choose the most convenient time of visit to receive a reminder about appointment. Clinic is located in the southern seaside part of Ukraine, which is heavily exposed to frequent missile attacks. Despite often air raid, alarm, and thanks to incredible commitment of our doctors and clinic staff, we have never stopped its work for a single day. From the first day of the war, through all panic, house, and active sharing clinic staff keep in touch with the clients as much as possible and stay at their workplace. Continuous psychology support and contact with the patients, courier delivery of a risk, ensure the maximum retention of clients in treatment and prevented drops from treatment. Given the global burden of STIs, especially in the context of its synergy with the HIV epidemic, and considering all war-related circumstances, we believe that setting up wellness centers in response to challenges of healthcare system would be the best practice. HF support expansion of STI clinic wellness center. Keeping in mind that military conflict always increases the risk of STI spread, HF Ukraine aims to replicate widely the services of wellness center model. HF Wellness Center focuses on clients with STI symptoms and sexual active individuals with high risk to STI and HIV. The first wellness center was opened in Odessa in July 2022, and in December 2023, the other one was opened in Kyiv. All services such as prevention, diagnosis, and treatment of STIs are free to charge for center clients. Sexual education and health support groups are also included to promote safe sexual behavior among clients. Specific feature of each center is a client-friendly atmosphere that welcomes clients to use a range of services from rapid testing for HIV, hepatitis C, hepatitis B, and syphilis to free condoms and lubricants. Each client can have an appointment and consultation of dermatovenerologist and receive treatment for STIs. We are strongly committed to expand the wellness center model, which is the key component of timely detection of STI and response to the threat of epidemic in times of war. Thank you for your attention.
So our next speaker will be Dr. Ksenia Voronova. She's an infectious disease specialist with over 15 years of experience in HIV and has served as AHF advocacy and marketing manager in Ukraine since 2022. And she leads advocacy effort collaborating with many partners to design HIV prevention strategy. And she will, the title of her presentation will be Resilience of HIV Prevention Service and HIV Infrastructure Support for Facilities Providing Service to People Living with HIV. Ksenia, the floor is yours.
It's an honor to be here with you today. I'm grateful for the opportunity to speak in this session. The Ukrainian healthcare system is facing extremely complex challenges due to the ongoing war in the country. This dangerous situation has given rise to a number of serious problems affecting the health and well-being of all Ukrainians. To overcome these challenges, a comprehensive strategy is needed, which includes not only medical, but also psychological and social support. IHF Ukraine actively cooperates with medical facilities through all territory of Ukraine to ensure access to preventive services. Prevention is one of the important and integral components of the testing model implemented by IHF in Ukraine. Based on experience of countries such as Libya, Ethiopia, Uganda, and Ukraine, which are living in war condition today, shows a significant portion of the population does not have free access to condoms. This is primarily due to the destruction of logistic chains and the occupation of territories, which make it difficult or impossible to supply free contraceptives. And the decline in the population's ability to pay makes it impossible to buy them if they even are available. Recognizing the challenges the public face in accessing condoms, IHF took proactive measures by distribution 1 million condoms in the 2 years of the war. In addition, we conduct regular educational classes for young people on sex education. We understand that there are significant gaps in knowledge among young people, which leads to an increased risk for sexual transmitted infection. So, through these initiatives, we aim to raise awareness and promote safer methods of protection young people's health and well-being. The results of our study on current trends in condom use in Ukraine that was conducted in 2023 confirm that our sexual education efforts are extremely relevant. Because 30% of respondents do not use condoms with occasional partners. And the main reason they do not use condoms is trust in their occasional partners. Additionally, the primary reason for using condoms, as indicated by respondents, is to prevent unwanted pregnancies, which only 36% citing protection against infection, and only 26% mentioning HIV prevention. This indicates that the general population is not sufficiently informed about the HIV situation in the country, where the primary mode of HIV transmission is sexual. Due to persistent shelling and consequent damage to the energy infrastructure, healthcare facilities must be equipped with the shelters and reliable power sources to ensure they can continue providing essential medical services. Recognizing the critical need for safety and uninterrupted care, IHF has undertaken comprehensive efforts to refurbish bomb shelters and procure generators for healthcare facilities. By repairing and upgrading bomb shelters, we provide a secure environment for both clients and medical staff. Our commitment to their improvements undergoes our dedication to supporting healthcare providers in these challenging times, enabling them to deliver continuous and safe medical care under any circumstances. In response to the challenges we have faced over the past 2 years of war, we have expanded our initiative Girls Act, where we work with the young girls to provide tools for their navigating difficult contexts aiming to prevent HIV, unwanted pregnancies, and violence. This program has become a lifeline and support for many girls in today's realities in Ukraine. Additionally, IHF launched a new initiative for Ukraine, Food for Health, where we distributed food kits to people living with HIV and their families, alongside training on home gardening for growing greens and vegetables. These programs not only provide social and psychological support, but also help retain clients in treatment. And I would like to conclude my presentation with a quote from IHF President Michael Weinstein, that we believe that access to healthcare is a basic human right. It's not just about treating HIV. It's about providing comprehensive healthcare to those in need. Thank you.
Our last speaker is Ricardo Fernandes. Is the Executive Director of GET Portugal, supporting communities most vulnerable to HIV with peer leader health service and advocacy. And Ricardo has worked in HIV field since.
Honor and a pleasure to present the work that we've been doing with people that choose, Ukrainian people that choose Portugal as their refuge during this difficult period of war. This is just an idea of all the services that GAT has around Lisbon area, and so that you could have the idea, we have services for all the vulnerable communities, and the main services that we provide others. It's basically screening for, of course, the 4 infections, HIV, hepatitis B and C, and syphilis, and this community-based screening. So it's not done by nurses or doctors, it's mainly done for community people that are trained to do it. Linkage to care, to health services, medical services, so beyond the 4 rapid tests, we provide other services, and of course, social intervention, because there's other needs that need to be provided to our community. And we, of course, do combination prevention. We offer all kinds of prevention that are available right now. This is just some pics of our colleagues. We are around 150 people working in GAT. Of course, they couldn't fit all there, but it's just an example. So just to talk a little bit about our project, which the name, it's You Are Not Alone. My colleague William, which is the coordinator, couldn't be here, but he helped me to prepare this presentation. I want to thank him and the team for the good work that they did. So GAT interventions in supporting access to HIV treatment began immediately after the conflict started, when we began receiving requests of assistance. From the start of the conflict until February 2023, GAT exclusively supported people in access healthcare. We only did that because it was something that we were already doing. However, later, thanks to funding from AHF, which we are partner for a lot of years, we were able to expand our response. Sorry. No, it's done. So thanks, as I was saying, thanks to AHF support, we achieve the stability that allow us to continue to do the work with the Ukrainian refugees, hiring a Ukrainian peer that was already working with us by that time. The project provides support to healthcare, hospital navigation, which means helping people to reach places, translation, developing information materials, workshops for Ukrainian community and also other professionals. We also cover transportation costs and additional transports over the country and prescribed medicine. So we also were paying other prescribed medicines or over-the-counter medicines. And we provide a monthly card with 100 euros so people in social or economical fragility could have some support. Of course, we were coordinating with our social workers, so we could promote integrated responses, so people could look for work, housing, and other things. So with this holistic approach, we were able to better promote the integration of our clients. So we also had to work communication. We had a lot of challenges to support Ukrainian community. So we were receiving requests from throughout channels that we were already using, but we had to open other channels that we weren't used to work with, like Telegram or even receiving. We were communicating to Instagram, but we were not receiving requests from the Instagram, and we started to receive. So this was established that we needed to work in this social media as well. So going to the key figures, so as you can see, we supported almost 200 people, mostly men, but an interesting number of female as well. And from this almost 200 people, 182 apply and obtain temporary protection status. And you could see that we had people from a lot of communities, like men who have sex in men, people living with HIV, people use drugs, sex workers. So it was some population that we usually work with as well in Portugal, and that we know that are at risk for certain infections. So they were most of them, they were located in Lisbon, which is the capital. So we did 160 screening sessions, and in these screening sessions we found 3 reactive cases for HIV, 2 for hepatitis C and 2 for syphilis, and most half of the people never had tested before. So we had also 33 medical and nursing appointments, and 88 people were linked to healthcare services, for HIV, for PrEP, for other things. Oh, sorry, I'm going. So here, sorry, I didn't pass the slide. You can see here the results. And you can also see that in the all people that were referred was also referred for people, for our colleagues. So we conducted escorting for all these people, for 152 people, to hospitals, local health services, local organizations, and regularization services, so that people could treat for the document. And we had the support of also 6 volunteers, we were very grateful for that, of course. So we had some challenges, and the challenges were mostly around the fact that we were working with a very sensitive issue for all the people, but mostly also for Ukrainians, which was HIV, sexual transmitting diseases. So people didn't come forward very easily with this matter. Also, the Ukrainian organizations that were there, they were having troubles also to trust troubles with us. So we had to work with them these issues. So we started to collaborate, of course, with a lot of Ukrainian organizations, also some services from other cities that we were already collaborated. But our strategy was to start talking about general health and other issues with the Ukrainian community, so that we could offer other things, and then at a certain point talk about HIV, STIs, and other things. So, of course, we were promoting workshops, access to health, generally speaking, because people were still wanting to access health for other issues. So we did 2 workshops with a lot of participants, with Ukrainian foods, also with Portuguese music sometimes. So we introduced Portuguese music to Ukrainian people for the first time. So these were valuable moments where we could mingle with the community overall. So we did these workshops, as I was saying, but we did also information materials in Ukrainian that were also in our website and that gave information about basic things. But we went further and we did a migrant kit that people could scan in partnership also with the HF. And in this, you could see that there are more than 80 informative materials, 8 in Ukrainian and other 12 languages that you can consult. We did also a hard print material, so people that can have access to internet could have it with basic information. And of course, we were over the internet presenting in Ukrainian also quick information about our services and access to health. Well, we hope that we can keep doing this work in the future. We have this challenge currently, which are a lot. We need to tackle them. I think we will have the support of HF and other organizations as well, and we will keep doing the phase 2 of the project. So this is all. Thank you so much for your attention. Thank you. Have a nice day.
So now we have 15 minutes for questions and answer. And I would like to start with you, Yaroslava. So what is the consequence? I know that you show how hard it is, and how you can adapt so fast, going from one region in the country to the other region and rebuild again the care for the people. So could you please tell us from your heart how hard it was and how you did it to provide the continuity of the service?
Okay, thank you for this question. First of all, I would like to say that we expected the war because we discussed this a lot, that the war will start soon. So, of course, we can't be prepared fully, but we understood that when we discussed inside of our team what we will do with personnel and with our clients when war will start it. So, it helped us to be prepared mentally, to be prepared to these circumstances. So when war started, in the beginning, we started to contact with our colleagues from western part of Ukraine that worked in healthcare facilities that provided HIV services, and asked them how HF can help, what we should do from our side to support personnel, first of all personnel and clients. So what we heard that personnel was ready but clients was completely confused this situation. They did not understand what place they should go to get IRT or testing. So first of all, we set up hotline to consult people. And this hotline worked 7 days and 22 hours. And all our personnel, not only relevant personnel, but all our personnel answers the question to our clients to explain what they should do to find services. And then the war put us new challenges. So, for example, lack of electricity. So we started to think about this in the beginning, and we set up like small heating points with heating devices and some food and water inside of healthcare facilities.
Thank you, Yaroslava. It's a really extra work that we never imagined that healthcare provider has to think and to do. So, Senia, how people are the young people during the war, how they behave, and also do you monitor during the war the increase of STI or HIV among young people during this period of time?
Thank you for the question. Yes, we, as Yaroslava mentioned, we thought that the war and all conflicts can increase infection, STI and HIV in the population, and we want. That's why we conduct our research in 2023 about condom trends in condom use in Ukraine, and we thought we have very interesting results, and we see that not only 42% of Ukrainians aged 16-55 years use condom during their lighter sexual intercourses with a regular partner, and only 17% use condoms. And we expect that this situation and lack of contraception can increase a number of STI and HIV infection. And if we talk about young people, that condom use behavior among young people age 16-25 differs from the other age groups, and young people in comparison to other age groups have more occasional partners and more likely to be engaged in spontaneous sex, with a high proportion of those who said that they did not use condoms because they did not have them at that moment, and but at the same time, young people are more likely to use condoms during all types of sexual intercourses with like regular partner. And also we thank you. And also we find that young people in comparison to other age group are often shy when it comes to condom use, and they often feel uncomfortable buying condoms or embrace to suggest condoms to their partner. That's why we try to implement all our prevention programs, and we provide many classes for sexual educations, and work a lot with these age groups every day.
Thank you, Ksenia. We have a question from the audience.
Morning, everybody. Can you hear me?
Yes, Yannis.
Wonderful panel. Thank you, Adele, and congratulations for all your work. I'm Yanis Mameledzis, a consultant for WHO Ukraine, and I advise on HIV PrEP and also harm reduction OAT. Sort of a question, some questions, comments. Sort of within Ukraine, I'm sort of interested also in kind of your efforts around PrEP demand creation. I think it's a critical component. For those who may not know, Ukraine actually has a pretty robust PrEP program compared to other countries in the ECA. Over 13,000 people got oral PrEP in 2023, and the country's about to start a pilot on long-acting cabotegravir PrEP. And so I think that's a sort of, as we all understand, it's a critical component to combination HIV prevention. So a little bit more sort of understanding about kind of your role in PrEP provision, but demand creation, because I still think as part of like sort of to the data noting on condom use, indeed, I think we have an opportunity to strengthen sexual health more broadly in Ukraine. And sure that means again, condoms, PrEP, and also something that should have noted from Yaroslav's presentation is around the STI testing, diagnostics. And I know, again, at this conference, there's been a lot of discussion on, again, the need to move from syndromic management to sort of more asymptomatic testing, more appropriate diagnostics on STIs. So maybe a little bit reflection on what AHF in Ukraine is like sort of thinking about in strengthening the STI services within your facilities. And just one more, and then to Ricardo for Portugal, I noted you had 116 MSM that you noted on your slide that you provided services, including HIV testing, and I missed a slide as to some of them may I assume everybody obviously is given PrEP information, but maybe PrEP initiations by Ukrainian refugees. I know it's a struggle in like many European Union countries. And PrEP access and the way to initiate varies from countries. So maybe if you can speak to the Lisbon experience because you guys have PrEP. Thank you very much to everybody and for your wonderful work.
Thank you, Yannis. I think we can start with Ricardo.
Thank you. Thank you for your question. As I mentioned, we referred, I don't know if, I cannot say that they were all MSM, but I'm sure that most of them were. We refer from that number of people, 88 were referred for PrEP in Lisbon. And I think that most of them, they were MSM. Access to PrEP in Portugal is not easy for everyone because unfortunately we have PrEP, but we don't have logistically. It's very difficult for the consultation, meaning that PrEP in this moment it's only prescribed. It was at that moment only prescribed by HIV doctors, which is quite limitative. Now the situation is different. It can be prescribed by other doctors, but we are still implementing that new intervention. So at that point, we refer 88 people to these kind of services, of infectious services, so they could get PrEP, and they probably had the same issues that Portuguese people had. But in terms of access, the access for PrEP is similar for refugees from Ukraine because they have this special status as well. But other migrants coming, for instance, from Sub-Saharan Africa, we can get them as well on PrEP. So, and for treatment is the same. Everyone in Portugal is entitled to have HIV treatment independently of their status. So it's quite easy to put people on the system to have PrEP, but sometimes the waiting list is quite huge because there was only HIV doctors prescribing it.
Thank you, Ricardo. So, we have also one question from online. Can you please, Oroslava, very shortly tell us how AHF, if AHF Ukraine is involved in PrEP, and you, Ksenia, about how to diagnose other HIV and other STIs. And the question from a virtual participant is about if you have any report among soldiers and also about veterans of if they increase STI and HIV among them during the war. So Yaroslava and then Ksenia.
Thank you very much. AHF established 2 wellness centers in Kiev and Odessa. This place mostly for prevention of HIV and treatment STIs. And this medical license places, this is like small STIs clinic. Of course, PrEP is one of component of services that provided by these clinics. So that's about PrEP, and these clinics also have agreement with National Health System. So all services clients can get on this clinic, including PrEP.
Thank you. So there is any data about the soldiers and how to provide this kind of service to the ones that are fighting?
Thank you for the question. Yes, we cooperate with some soldiers. We provide testing if they ask for that. But for today, we don't have data because it's we only start to and cooperate with, and we think that we maybe need more time, and then we receive data from this group.
Thank you. We have another question from the audience.
Yes, I'm Susan Hillis from PEPFAR and also Oxford University. And I want to thank the Ukrainian leadership on stage and elsewhere online, because I think the world has been watching you and learning from you in terms of courage and determination. I also wanted to share that just last night, a paper summarizing a study I've been involved in with Ukrainian leaders has just been published, and I'm happy to talk with you about it afterwards if you want. And it's about the effectiveness of hope groups. It's a mental health and violence prevention intervention for parents caring for children in the midst of either the war-torn cities, internally displaced and externally displaced. And they showed great effectiveness. And I just want to let you know, UNICEF is thinking about rolling them out through the resilience centers. But anyway, I have access to the master trainer, and there's some training available. So I wanted to let you all know. I don't really have an easy way to let anybody know, but I guess that, you can talk with me afterwards. I'll be happy to talk with you. But I also wanted to ask you, it's been impressive that your wellness centers have reached out to provide food, that it hasn't just been a static, like waiting for people to come, but you've reached out to people into the community. Can you say a little bit more about currently the kind of psychosocial support, Ksenia? I guess you were talking about that's available in the resilience or wellness centers. Thank you.
Thank you, and congratulations for your paper, Ksenia. Just to clarify, Health for Food is a program inside the AHF that provides food for HIV clients every country at the 45 countries where we work. But maybe Ksenia can explain a little bit more about the Food for Health program.
Yes, thank you for the question. We provide food kits for people who live with HIV and for their families. We cooperate with medical facilities through all territory of Ukraine. And when some of the people who live with HIV need this help, we provide these food kits from medical staff directly to their person, and also we have very big initiative. It's Star Club, where peer-to-peer consultant support all people who live with HIV, and we have peer-to-peer meetings, and in this meeting we also provide food kits for people who need this, and also we send it by post directly to the person.
You can add, Roslava, and we can also, after that, have the last question because we have to finish the session.
Yes, I would like to add that Food for Health, this is not only about ensuring of food packages. We started to teach people gathering and ensure them with seeds, for example, and trainings, because this is very important thing to teach people to ensure food themselves.
Thank you. The last question.
Good morning, everyone. I'm from Nepal. I'm working at National Association of People Living with HIV/AIDS in Nepal. We are working at 57 district and 61 site HIV care and support program implementing. There we are thankful for HF Nepal, HF whole team. They are big support for PLHIV. I am also PLHIV activist in Nepal. Thank you for support, and I will very humbly to say we are working together. Nepal is the best, care and support service in there. Support PLHIV support. So I would like to ask you one question: how to testing our community lead testing? What type of community lead testing you have? Also, what is the procedure? Also, what is the processing? Also, community lead testing. I will ask you.
Thank you for this question. We have small, mostly our program connected with healthcare facilities and testing with initiative of healthcare providers. But small community testing we have in Lviv. This is western part of Ukraine, and there is we have a checkpoint. Mostly this checkpoint tests MSM community. In Kyiv we has mobile unit and tests everybody on the street, and mostly this mobile unit tests people who inject drugs.
Thank you, and we are finishing, and we hope that the experience shared here by different perspectives from these people here that are really engaged in the continuity of care among the war in Ukraine provide you some insights and into a step that can be taken to assure staff safety and support the mission of caring for clients throughout catastrophic events as the war. So thank you and have a good day.